Hello everyone. Today I am going to cover the competency number 7.4. In this I am going to tell you the advantage of the breast milk. So advantage to the baby, mother and the family members. So in the benefit of the breast milk to the baby, colostrum is the best first food for the baby because it protects against various infections. Breast milk easily digested because containing higher whey protein and also active lipase for the fat. It provides all the nutrients for the first 6 months of life. It is rich in the polyunsaturated essential fatty acids, which is required for the growth of the baby's body and the brain. It is also rich in essential amino acids, which is required for the healthy and also provide the complete nutrition. Iron concentration in the breast milk is 0.01 to zero point 0.1 milligram per 100 ml and its bioavailability almost 50%. So 50% of the iron in the breast milk is absorbed, while in the other dietary source of the iron bioavailability less than 25%. So baby will not develop the iron deficiency anemia in first 6 months of life if on exclusive breastfeeding. Calcium and phosphorus ratio is also more than 2:1 in breast milk. So this ratio is very important. It protects against the neonatal hypocalcemia. Low sodium in the breast milk 15 milligram per 100 ml. So solute load on the kidney is also low. As we know, the kidney are not mature fully in first 2 years of the life. So this low sodium concentration is very important to protect the kidney. While in the other milk and the infant milk formula, this solute load is almost 3 times, as in the cow milk, sodium concentration is 3 times, 43 milligram per 100 ml. So baby cannot tolerate this high concentration. Higher concentration of polyunsaturated fatty acid protect against the heart diseases in adult life. Long chain PUFA also helpful for the retinal development. pH is also low in the breast milk, so organisms do not grow in the breast milk. Various anti-infective factors present, so baby get the full protection. Especially in the colostrum, high concentration of these anti-infective factors, so early onset sepsis chances are very less in the baby. Immunoglobulins IgM, IgA, leukocyte, macrophages, lymphocyte all protect the baby. Bifidus factor, this is also important. So GI infection chances also less with these protective immunoglobulins bifidus factor. Lactoferrin transferrin lysozyme also helpful to protect the baby against various infections. Anti-staphylococcal factors so the gram-positive organisms cannot grow. Para-amino benzoic acid concentration is low in the breast milk. So malarial parasite cannot grow whenever baby is on the breast milk. How does breast milk protect a baby from infection? By this image you can understand whenever mother is infected, WBC in the mother's body make the antibodies to protect the mother. Then same WBC go to the breast and make the antibody there. And these antibodies secreted in the milk and baby get the protection. What are the other benefits? Emotional bonding between the mother and the baby increases with the breastfeeding because mother is giving the skin touch to the baby whenever giving the breastfeeding, and it also stimulates the oxytocin reflex. So mother is having the feeling of love with the baby with the breastfeeding. IQ of the baby, both verbal and performance IQ better by the 6 and 8 points whenever baby is breastfed. As we know, breast milk contain the long chain polyunsaturated fatty acid, especially DHA, docosahexaenoic acid, which is a omega-3 fatty acid, and it is important for the brain development of the baby. Other than infection, also protect against various diseases, allergic disorders, heart diseases, diabetes, and lymphoma. Its chances are very less in childhood and adulthood. So what are the benefits of the breastfeeding to the mother? Prevention of anemia occur by decreasing the blood loss after delivery. Oxytocin reflex stimulated by the breastfeeding, and oxytocin hormone helpful to prevent the blood loss and PPH. Also increase beauty by the weight loss whenever mother is giving the breastfeeding, so helps to regain the normal figure faster. Oxytocin also helps in involution of uterus. Also, it improves the birth spacing. As we know, when mother is giving the breastfeeding, prolactin reflex is stimulated and prolactin hormone suppress the GnRH, FSH and LH. So, ovulation is suppressed by the lactation. So, delay the pregnancy and improving the birth spacing. Breast do not sag whenever mother is giving the breastfeeding. Also, chances of breast, ovarian, uterine cancer decreases whenever mother is giving the breastfeeding. Now, what are the benefits of the breastfeeding to the family? Child survival is drastically improved with the breastfeeding. It decreases both morbidity mortality by decreasing the chances of neonatal sepsis, diarrhea, pneumonia, various allergic disorders. So, reduce the healthcare cost. It is economical. As for the infant milk formula, they have to spend the money to promote the family planning because prolactin reflexes releases which suppress the ovulation. So breastfeeding also helpful for the family planning. It is environmental friendly, it is natural, it decreases the mother's workload to prepare the formula milk and other animal milk. Mother is supposed to clean the utensil and also supposed to prepare and then give to the baby by the katori spoon feed. So it is time consuming to give the other milk other than breast milk. So by breastfeeding, time and energy both can be saved. Thank you so much. This is all about the advantage of the breastfeeding.